Welcome to The Explainer. Today we're talking about something that happens in the one place we're supposed to feel the safest, a hospital. We're diving into healthcare's hidden epidemic, that invisible war against infection that's being fought every single day.
Okay, let's just jump right in with a number that'll really stop you in your tracks. On any given day in the United States, about 1 in every 31 patients in a hospital is fighting an infection they got while being treated. Think about that for a second. That's an infection they didn't have when they first walked through the door.
This is a huge, expensive, and frankly, really dangerous problem. But what's so fascinating is that the solution isn't some high-tech, futuristic gadget. Nope. It all comes down to understanding and, consistently applying just a few simple but absolutely crucial principles. So let's break them down.
All right, first things first, we gotta define the problem. To fight this battle, we have to know exactly what we're up against. And this invisible enemy? It has a name: healthcare-associated infections.
A healthcare-associated infection, or an HAI, is pretty much what it sounds like. You go in for, say, a broken leg, but you end up leaving with a serious bloodstream infection from an IV line. Or you have a totally successful surgery, but then develop an infection at the incision site. And the key thing to remember is, these are preventable.
And this quote right here, it just perfectly illustrates the stakes. The World Health Organization puts it so plainly: you just can't have safe, quality healthcare without good infection control. It's not some optional extra. It's the absolute foundation of keeping patients safe. Period.
So how do these germs actually get around? Well, what's interesting is that it's not as mysterious or complicated as you might think. And that's actually really good news, because if we understand the pathways they take, well, we can block them.
So basically, infections spread in 3 main ways. First up is contact, literally touching an infected person or a contaminated surface, like a doorknob or a bed rail. Second is through droplets, think coughs and sneezes, that travel a few feet. And third, through tiny airborne particles that can just hang out in the air for a really long time. Okay, so if we know how the germs are spreading, we can build a really powerful toolkit to stop them right in their tracks. Let's take a look at the simple but super effective tools we have in this fight.
And we have to start with the single most effective tool in the entire arsenal. And it's not some fancy machine. It's just an action, proper hand hygiene. And get this, it's estimated that just cleaning your hands at the right time can prevent up to 50% of avoidable infections. Half of them. That's just incredible.
And the protocol here is really straightforward. If your hands look dirty, you gotta use soap and water for at least 20 seconds. If they don't look dirty, a good alcohol-based rub will do the trick. But the golden rule for healthcare staff is totally non-negotiable. You clean your hands before and after every single patient encounter.
Next up in our toolkit is personal protective equipment, or PPE. You can think of this as our armor, our physical barrier. It's our last line of defense. We're talking gloves for touching fluids, gowns to protect from splashes, masks for droplets, and those specialized respirators for airborne diseases. It's all about picking the right shield for the right threat. And finally, we have the environment itself. Germs can live on surfaces for hours, sometimes even for days. And that means cleaning has to be absolutely relentless. We're talking about disinfecting those high-touch surfaces like bed rails, exam tables, and all that equipment between every single patient. So we've seen the simple, powerful rules, but now let's look at what happens when they get broken, because the real-world consequences can be absolutely devastating. This is where the theory smacks right into a very harsh reality.
Let me walk you through a real case. A patient who everyone knew had hepatitis C needed a CT scan. It was a standard, everyday procedure that required an IV injection, the kind of thing that happens hundreds of times a day in hospitals everywhere.
So to flush out the patient's IV line, a staff member used what's called a multi-dose vial of saline. Now, these vials are meant to be used under really strict, sterile conditions, but right here, a critical error was made. That vial was used for more than just one patient. And honestly, that was all it took. A microscopic, completely invisible drop of blood from that first patient, the one with Hep C, got back into the vial. Just like that, the entire supply was contaminated.
The result of that: one single lapse, 12 other patients, people who just came in for their own routine scans, were infected with hepatitis C. 12 lives were changed forever because one simple fundamental rule was broken.
That tragic story is such a sobering reminder of what's at stake. But you know what? It also points us directly to the solution. We win this fight, not with one single heroic act, but with absolute, unwavering consistency in doing the small things right every single time.
And the proof is right here in the data. When hospitals get serious and they launch these big campaigns to improve something as basic as hand hygiene, with training, reminders, making sanitizer available everywhere, the results are just dramatic. I mean, look at this chart. A focused effort cut infection rates by almost half. The numbers don't lie.
So what's the bottom line here? It's this. The path to winning is paved with these simple, powerful actions. These aren't just suggestions. They're the core responsibilities that build a real culture of safety. From washing your hands to cleaning surfaces and having the courage to speak up when you see a problem. This is how we protect everyone.
Ultimately, every single infection that we prevent is a life that we protect. It's a victory that isn't won in some big dramatic moment, but through thousands of small, correct choices made day in and day out. The power to turn the tide against this hidden epidemic is, quite literally, in our hands.